variants like the Alpha and Delta variants, for example, first discovered in the UK and India, respectively, have been more transmissible than previous strains of the virus. The World Health Organization, for its part, and other public health bodies are now trying to understand how the new Lambda variant compares to the others, including whether it could be more infectious and resistant to vaccines. Joining us to talk more about this is Dr. Jinal Bhiman, Principal Medical Scientist at the National Institute for Communicable Diseases. Doctor, afternoon, grateful for your time. Let's talk first, we'll get to the Lambda variant more specifically, but I want to speak about the work that is done by yourselves as scientists in identifying the existence of a variant in the country.
Good afternoon to you and your listeners. So in terms of identifying new variants, especially in South Africa, we have a really strong consortium that is continually monitoring the evolution of the virus. And this is really from routine diagnostic samples that come up positive in the country. We then take those samples and we sequence the virus that's within them and just continually monitor and look for changes and look for anything that might be unusual compared to what's currently circulating in the globe and what's currently circulating in South Africa.
And then this Lambda variant, then first identified in Peru at the end of 2020, identified, I think, in a couple of dozen countries at this point. No cases found in South Africa as yet. How does it differ from Delta and the others?
So no cases in the entire African continent as yet. And how it differs from Delta, from Alpha, and from Beta is that it just has different immune escape mutations scattered throughout the spike protein, which is what the virus uses to gain entry into our cells. But thankfully, it does not have the mutation that we know is associated with increased transmissibility that we've seen in both the Alpha and then also in the Delta variant. So it doesn't have those mutations, but overall just different immune escape mutations.
And the tricky thing, I suppose, with genome sequencing and work that's done to identify variants in circulation is that they do have to be present in a population before they can be found. And the risk in that would be that if I, for example, come forward and test positive and you say, indeed, this is the first case of the Lambda variant, it is likely that there would be more than one case at the point of identification. Is that right?
Yes, that's definitely correct. Genome sequencing is not trivial. It's quite challenging and it's quite lengthy. So you're absolutely right. We cannot keep up in terms of the number of cases that are in the country. We do a lot less in terms of genome sequencing. So you're absolutely 100% correct there.
Let's speak then about the significance of identifying the variants in circulation and why that work has to continue, even though it's not necessarily a preventative tool of first resort.
I think, we would hope that we could make a difference in terms of prevention, but I think realistically in a low to middle income country, we don't have the resources, for example, that are in the UK or the US where we could do contact tracing and immediately lock down particular regions where we're seeing an explosion of new variants. So from our perspective, the more important thing is to monitor what variants are becoming predominant in terms of how they might impact vaccination and how they might impact pathogenesis overall of the virus. So that's really the main aims of us doing the genomic surveillance that we do carry out.
As far as information on the Lambda variant and vaccine resistance possibly, is there enough scientific data to speak to that question?
Not at this point. There is some preliminary laboratory tests that have shown it's not as resistant, obviously, as the Beta variant. It's not as sensitive as the original virus that's being used, or the sequence of the original virus that's being used in the vaccines. So it's a little bit kind of like the Alpha variant in terms of immune escape, but like I say, not a lot of research yet. It's still very, very preliminary and all lab-based. So yeah, that's unfortunately not a lot that we know in that regard.
You will have seen the conversations when the Delta variant was pushing those infections in India, and people were bombarded really with images of hospitals completely overwhelmed by patient numbers, people being buried by the thousands. South Africans then responded and said, well, perhaps we need to close our borders to people traveling from India to South Africa. border closures an effective way of managing the movement of variants?
I mean, I think you stand a chance of that being effective if you're an island, because you have complete control of all your borders. But I think a country like South Africa, yes, we do have control over some of our airports and sea borders, but our land borders really, are quite leaky. So I don't think it's an effective control strategy for us. Unfortunately. And the other caveat with closing borders is that not every country is performing the same level of genome sequencing as South Africa, as other countries like the US, the UK, some other European countries. And so you don't actually know necessarily where a particular virus or particular variant has spread through. So if those countries do not have as high genomic surveillance capacity as others, you might not even know that that new variant is already in that country, and therefore, can be a route of transmission.
And it reminds me of the conversation that you guys were having as scientists as we began to see more than one variant, and we had to watch our language around using a geographic location as a means of identifying a variant, because scientists were saying even then, if I recall correctly, that the fact that a variant is first identified in a particular country does not necessarily mean that that is the country of origin.
Exactly, yeah. That's exactly the same reason. Not all countries have the same level of genomic surveillance at this point. And I just wanted to add one more thing regarding, the genome sequencing. So, for example, that many countries have imposed travel restrictions on South Africans or to South Africa because of the previous beta variant dominance. And now that we've shown that the Delta variant is now dominating, people are thinking about maybe easing up on those restrictions. And that really relates to the level of resistance that the Delta variant has, which is much lower to vaccines than the Beta variant. So it is important for us to continue to monitor, especially in terms of our economy, tourism, and those kind of things. And then also to just bring focus back to the Delta variant. I know there's a lot of concern about the Lambda variant, but right now the Delta variant is wreaking havoc in our country, So while there might be concerns about a new variant, we are really struggling at the moment because this Delta variant is so much more transmissible, and we really need to deal with what we're currently facing in terms of that.
Dr. Bhiman, such a pleasure to speak to you. A lot learned from these past few minutes. Thank you so much for your time today. That is Dr. Jinal Bhiman. She's